Breathing is an activity that guarantees the body the oxygen necessary for the production of energy and the elimination of carbon dioxide resulting from chemical reactions. During the practice of physical exercise such as cycling, a controlled breathing can mean a gain in performance, postponing fatigue and health benefits. Breathing is an activity executed so mechanically that we often neglect its importance during the exercise of pedaling. It is common for cyclists to seek information and techniques to become more agile and efficient, buy high-value equipment, and take other initiatives to improve performance in tests and trails. But the real engine of all this is the human body, and breathing is one of the main fuels. Breathing in the right way helps to control cardiac activity and favors physical conditioning, regardless of your training. If the practitioner has controlled breathing, he will achieve that the body improves its performance, making the absorption of oxygen in the body better. This will also help in controlling the heart rate, avoiding fatigue and overload. This happens because a rhythmized and controlled breathing makes the heartbeat stable, and thus the cyclist performs the same job with less effort. For everything to work well, not only breathing must be correct, but the cyclist's bike must be comfortable and fine to allow the body to perform all its functions. About 20 muscles are activated during breathing, and the vast majority are related to posture. The main ones are the external intercostal muscles and the diaphragm, which work during breathing, and the internal intercostal muscles and the abdominal muscles, which work during breathing. The respiratory capacity improves with good posture. If the cyclist is well adjusted to the bike, the capacity of the lungs to expand will be ideal. The bad positioning overloads some muscles used in breathing, and this negatively influences the cyclist's performance. Take advantage of the fact that you are learning to breathe better and subscribe to our channel. This way, you stay on top of everything in the world of bikes. But continuing on our subject, in addition to a good bike fit, another interesting tip is strengthening and stretching exercises of the muscles involved in breathing. Pilates exercises that work the core are a good option. Studies show that the effects can be negative in the performance of the cyclist when there are deviations in the respiratory pattern. Tachypnea, increase in respiratory frequency, increase in dynamic bloating, and consequently, increase in respiratory work, which can result in what is called blood stealing, when blood migrates from the peripheral muscles to the respiratory muscles, as well as tripping, CRBATIS. When blood migrates from peripheral muscles to the respiratory muscles to meet their demands. With this, there is a decrease in energy in the peripheral muscles, such as those of the legs, so required during the pedal. It can also occur muscle fatigue, respiratory, and increased dyspnea, lack of air, which results in a decrease in the athlete's performance. These respiratory insufficiencies compromise the gas exchange, which anticipates muscle fatigue, and even causes the loss of pedaling technique, which can cause injuries. To improve breathing, the guidance is simple. People should always follow the natural body procedure, inhale through the nose and exhale through the mouth. There is no better control than this, because if you do this, your attention will be a little out of focus, which should be the training, test, or walk. When the cyclist becomes breathless, it means that he has reached the anaerobic threshold, and the production of carbon dioxide has increased. Being breathless means a message from the body asking for a gas exchange, and this substance is eliminated. It is important to control breathing at this time and adjust physical effort until the anaerobic threshold is lowered to return to normal rhythm. The practice of cycling is beneficial in terms of respiratory capacity as long as it is practiced within the limits of each individual. According to Luciano, cycling, according to frequent practice and above 30 minutes of activity, improves the respiratory capacity, resulting in a better absorption of oxygen by the body. Develop the main heart muscle, the heart, which will promote greater caloric burn, reducing body fat and regulating cholesterol. Prevent heart and respiratory problems and promote better blood circulation. The human body is an incredible complex creation. There is no way to think only about your limbs separately. Everything is connected, and its simplest and most mechanical functions, such as the act of breathing, are important for overall functioning.